Morning. People are asking if there's an alcohol blocker. And it's a great question because we use an opioid blocker called Naltrexone because it goes to those opioid receptors or the endorphin receptors in the brain and blocks them. It just sits on that receptor and it can't, can't be moved. So, opioids, heroin, fentanyl can't get in, so it blocks perfectly. It turns out that Naltrexone is a pretty good alcohol blocker as well because it turns out that Naltrexone blocks some of the pathways of alcohol, particularly the pathway where people get a buzz or a high or a pleasant dopamine effect from the alcohol. So it doesn't technically block all of the effects of alcohol. So people, when they're on Naltrexone, they report their cravings go way down. They're not looking for it. If they do drink, they don't enjoy it much. They don't get the dopamine rush from it because that naltrexone's blocking the endorphin receptors. They can still get sloppy drunk and have a hangover and feel all the negative effects. So it's kind of a cool drug. We've had amazing success with it with patients who say, I love being on the Vivitrol or the naltrexone implants because it takes my cravings away. If I do slip up, I don't enjoy it. And it's easy to sort of say, oh, that was a stupid mistake. I need to work my program more, go to more support groups, get back into counseling, all of those kind of things. I have to say, Antabuse is not an alcohol blocker, but it kind of is a blocker because when you take Antabuse, you can't drink even a sip or you'll get deathly ill. It doesn't kill you, but it's what I tell patients that it makes it, you wish you would die because you feel so bad. And it lasts for like 3 days. So Antabuse is a great drug, especially in the early first few months when cravings are high, because you take it every morning, and for now 3 days you can't drink. And so your mind knows that, so your cravings go away because you just know that you'll get deathly ill, so you don't drink. And it really is a way to help people really get a little extra support in those first critical few months while they're getting involved with therapy, they're getting a sponsor, they're going to their meetings, they're working their program and learning how to live off the alcohol. So there's a lot of options for people who have an alcohol problem. If you know anybody, give us a call and we can help.